Hi and welcome. We are going to be doing a PDO lifting threads treatment today for this particular patient. You can see I've already marked the left side of her face and now we're moving to the right side. And at this point I'm just treatment planning, and treatment planning honestly is an incredibly important step. Your treatment plan sort of determines everything. So if your markings for your entry point or your ending point are not in the best place, you're really not going to deliver the best results. And so it's all about having the patient animate, evaluating their face, where you really see, when they smile, what does the tissue do in their midface, and so on, to determine where's going to be an appropriate place to enter, where do we get the best pull. And so you can see here I'm doing just that, just sort of mimicking what it would look like once we have the threads in and determining where I want to start and stop my threads. This patient, we are doing a 3-vector lift plus a jawline thread. So that includes treatment of the nasolabial folds, the marionette, the jowl, and the jawline. If you're looking at this patient, you might think, well, this patient doesn't have a whole lot to lift. And that is true. She is younger. This is for prevention. The patient is really concerned about sort of the lower face. So oral commissures, marionette lines. She doesn't like that lax tissue in the lower face. And we've done a whole bunch of different treatment options for this patient. We have done hyperdilute radius, we have done mid-face filler, and so at this point we decided maybe we need to do some PDO lifting threads to try and really lift the tissue. It's hard to appreciate in the video, but she does have thicker skin, and so we elected to do a PDO lifting treatment to help really give her the lift that she's looking for. Your younger patients with PDO threads are generally looking for like a pretty snatched jawline, more definition, and it's really it's really easy to achieve that when you don't have a whole lot to lift. So she's a wonderful candidate, and so we will go ahead and watch the treatment here. If you noticed, I used lidocaine to numb my entry point, and now I'm using a blunt tip cannula. This is a 22 gauge by 75 millimeter cannula, and what we're doing here is not only creating the path or the tunnel in which I'm going to place my thread, but this is also how we deliver anesthesia. So I'm working my cannula to that distal end of my vector, and I'm retrograding out, delivering lidocaine so that she'll be nice and numb for the procedure. I always tell my patients, like, they tend to tolerate this better than filler because they're locally numbed, so they tend to do quite well in terms of the procedure itself. So you can see we're retrograding some lidocaine, and then I'm going to redirect and also numb my other 2 points for my vectors. And so you can see she's tolerating it really quite nice. I will say part of the pinchy area is as you approach the mouth, there tends to be some ligaments and so on that can be a little bit uncomfortable to get through, but she's doing really nice. She's a great patient and tends to tolerate a lot of these procedures quite well. Once she's numb, then we're going to go ahead and grab our VSoft lift threads, and this is where we're going to place them directly into these vectors in which we've numbed, and it should be pretty easy to place them because we've already created that tunnel in which they're going to fall. So here's the numbing of our last vector. Depth is incredibly important. As you can see, a couple of times I've sort of pulled back and readjusted. I like to make sure that my depth is perfect with my cannula, because if I'm creating a path for my thread and the path is wrong, then the thread is going to go into the wrong plane as well. Maintaining the proper plane is incredibly important for a couple of things. Of course, avoiding potential for complications. If we're too deep in these vectors, then you are closer to your large vessels and nerves, and you increase the risk for potential complications. If you're too superficial, there's aesthetic complications such as puckering of the thread, dimpling of the thread visibility, and so on. So proper depth is really important in order to not only deliver the most beautiful results, but to minimize complications post-procedure. In addition, if you're in the wrong plane, you're not going to get the lift that you're really looking for. And so being able to find and maintain your plane can be difficult for new learners. An in-person PDO lifting course is always something that I recommend. for people interested in adding threads to their practice. It does take several cases before you really feel comfortable finding that plane and staying in that plane. And so in our PDO lifting threads course, we do just this. You bring a model and we go through treatment with you. Of course, you're the one treating the patient, and we help you find that right plane. It's all a feel, it's a look, and it tends to be a little bit of a different skill than some are used to. And so it's important not to get discouraged and just continue practicing. The more cases you do, the more comfortable you'll feel. And the next thing you know, these will just sort of be second nature for you. You really can get into that plane pretty easily and deliver some really beautiful results. So here you can see we're pretty much flying through the procedure here. We're already placing that third thread before we move down to her jawline. And now same procedure, we're going to numb the entry point before we numb the vector, and then we'll place our thread there as well. But you can already see how much tighter she looks around the mouth just with the upper threads that we placed. So I can already tell that she's going to get some really nice results. And at this point, this is our blunt tip cannula, just some lidocaine in here that we're going to use to numb this area. And always, of course, making sure that the depth is appropriate again, especially in this lower face area. As you approach the chin, there tends to be a lot less tissue than when you first enter. And so if you get too superficial here, you're really going to see that thread as it approaches the chin. And so, every time they animate or smile, you can see it. So really, it's crucial that we know that our depth is good here before we go ahead and put our thread in. And there's the thread that we are using. And again, it should just glide because we've already created that tunnel for it. So the PDO lifting threads, they are barbed so that they lift tissue. Once your cannula is removed, those barbs are going to lift the tissue, tack it up in place, and then the beauty of them is that they are biostimulatory. They are a polydiaxanone material that stimulates collagen and elastin as they dissolve. So not only are we going to get that immediate lift, that immediate improvement, over time, once we stimulate that collagen and elastin, we can expect the results to look even better. People tend to look their best, I would say, about 3 months post-procedure. Collagen takes time to build, as we know, and 3 to 6 months is really that peak neocollagenesis timeframe that we can expect. So by 3 months, everything is looking great. We're going to head and trim her threads here, get her cleaned up, and then we'll put some Band-Aids on her, and she's on her way. Typical downtime, I would say, is about a week in terms of bruising and swelling. Generally, it's very important to avoid high-impact exercise like jumping and running and things like that because it's actually working against your lift. That gravity is not really our friend as we age. And so if we're really creating that pounding movement, we can weaken the lift. You can also increase the risk for potentially breaking the thread. And so it's really important to educate your patients on how to take care of their face after this procedure. So we're just engaging our threads here, making sure everything looks nice and smooth. And we'll sit the patient up here so you can see her results. And she looks super happy. She's much, much tighter around the mouth there. And she's thrilled with her results. Thanks for watching.